Feasibility, efficacy, and safety of animal-assisted activities with visiting dogs in inpatient pediatric oncology. Childhood cancer entails a heavy burden for patients and their families. In recent years, advances in overall survival has increasingly brought the long-term quality of life into focus. Animal-assisted activities have long been hypothesized to alleviate the burden on pediatric patients and their peers in the hospital setting. However, its use in inpatient pediatric oncology has been a sensitive issue, especially because of the fear of infections, resulting in a sparsity of studies. We conducted a single-center study to collect data regarding feasibility, safety, and efficacy. For this, 60 patients with malignancy under treatment were visited by a therapy dog, with a total of 100 visits. Patients were screened for infections as per hospital policy. Additional microbiological testing was performed based on symptoms. The dog was screened for human pathogens and zoonoses. Microbial data and hospitalizations were analyzed in a period from 2 months prior to first visit until 2 months after last. Acceptance of being in the hospital with and without planned dog visit and pre- and post-intervention state stress were measured using a validated visual analog scale from 0 to 10. As a result, we found that patients benefited from visiting dogs, with increased acceptance of being in the hospital and decreased median state stress, 1 hour after the visit compared to 1 hour before the visit. The intervention did not result in increased number of infections. The incidence density was higher prior to the dog visit than after. Also, serious adverse events and unplanned hospitalizations were not increased after the dog visit. No zoonoses were detected. All microbial screening tests of the dog were negative. We conclude that animal-assisted activities with visiting dogs in inpatient pediatric oncology are feasible and safe. It holds the promise of enhancing the patient's well-being. Prospective studies are needed.